Eosinophilic esophagitis is a long-term immune system disease that causes inflammation to your esophagus, the tube that connects your mouth and stomach. Scientists think this may happen when your immune system reacts to an allergen in food or your environment. EOE has identical symptoms to the digestive condition gastroesophageal reflux disease, like trouble swallowing and chest pain. In fact, not so long ago, if you had eosinophilic esophagitis, your doctor probably thought you had GERD. It wasn't until the 1990s that doctors realized that EOE isn't caused by GERD. More and more people are being diagnosed with EOE, though it's still considered a rare condition. It often starts when you're a child or young adult, but you can get it at any age. What are eosinophilic esophagitis symptoms? Symptoms of eosinophilic esophagitis include trouble swallowing solid foods, known as dysphagia, heartburn or upper abdominal pain, an itchy throat when you eat, food impaction, which is when food gets stuck in your esophagus, vomiting, failure to thrive. Many of these symptoms are also signs of GERD, which is why the two conditions were long thought to be the same. The key to diagnosing eosinophilic esophagitis is that people with EOE don't get better with GERD. Medications. What causes eosinophilic esophagitis? EOE happens when too many eosinophils, a type of white blood cell, build up in the wall or lining of your esophagus. This causes inflammation in the tissues there. That can result in damage that leads to discomfort, trouble swallowing, and other symptoms. Scientists aren't sure exactly why this happens to some people, but it's thought to be caused by an allergic reaction to certain foods or substances in your environment. Heredity is also thought to play a role. What are the risk factors for eosinophilic esophagitis? Anyone can get EOE, but things that affect your odds include food allergies. This seems to be the biggest risk factor for EOE, but doctors aren't certain how it works. They haven't figured out how and why certain foods trigger white blood cells to travel to the esophagus, or why this reaction happens in some people and not others. Dairy, eggs, soy, and wheat are the most common culprits. Other allergies. Up to 70% of people with EOE also have environmental allergies, asthma, eczema, atopic dermatitis, or allergic rhinitis. Sex. Those who are male are 3 times more likely to have EOE. Family history. You're more likely to get eosinophilic esophagitis if one of your relatives has had it. Climate. If you live in a cold or dry area, you're more likely to get EOE. It also tends to flare up in the spring, summer, and fall. How do doctors diagnose eosinophilic esophagitis? EOE is the most common cause of eosinophils in the esophagus, but other things can also be causes. And because the symptoms of eosinophilic esophagitis and GERD are so similar, your doctor will have to rule out acid reflux before settling on a diagnosis. They can do this with tests called an upper endoscopy and a biopsy. For an endoscopy, your doctor puts a thin tube with a camera on it down your esophagus. Eosinophils will usually show themselves on the endoscopy as pale or white flecks. There could also be lines, creases, and other signs of inflammation. But things could also look normal even if you have white blood cells present, which is why your esophageal tissue will also need to be biopsied. For a biopsy, your doctor takes tissue samples from your esophagus so they can look for eosinophils under a microscope. If you have eosinophils in your esophagus, your doctor will start you on GERD medication to see if it helps with your symptoms. If your next endoscopy and biopsy are normal, acid reflux is the problem. If not, it's probably EOE. How do doctors treat eosinophilic esophagitis? There's no cure for EOE, but treatment can help you manage the inflammation that causes symptoms. The main ways to do that are with diet changes and medication. Treatments include an elimination diet. This involves removing certain foods that are common allergens from your diet, then adding them back one at a time. Cutting out foods that you're allergic to can help reduce symptoms within weeks. Proton pump inhibitor. This is a type of drug that reduces stomach acid. It sometimes helps with reflux symptoms, but it doesn't work for everyone. Corticosteroids. Steroid drugs, like budesonide or fluticasone, help control inflammation. You take oral budesonide as a liquid by mouth. Fluticasone comes in an inhaler, but you swallow the mist rather than inhale it when you take it for EOE. These drugs tend to cause fewer side effects than steroids you take as pills. Monoclonal antibodies. Your doctor can prescribe dupilumab to ease inflammation and help you swallow. You get it in a shot or an IV. It works by blocking substances in your body that are involved in causing inflammation. These drugs are used only in people over age 12. Esophageal dilation. If you have scarring in your esophagus due to eosinophilic esophagitis, your doctor may try this minimally invasive procedure to help you swallow. For this procedure, they put a balloon into your esophagus through an endoscope, then blow it up. Which foods should you avoid with eosinophilic esophagitis? Common foods that can trigger a worsening of EOE symptoms include milk, eggs, soy, dairy, seafood, and wheat. Doctors sometimes call this increase in symptoms a flare-up. But it can be hard to figure out exactly which foods trigger flare-ups in your case. That's because the response to the trigger doesn't usually happen right away. You might eat a particular food for weeks or months before it starts to cause a problem. A food diary can help, along with an elimination diet. Talk to your doctor about the best way to track the foods that could be triggering your EOE flare-ups. What are the complications of eosinophilic esophagitis? Doctors don't yet understand all the long-term complications of EOE. They do know that in some people, EOE can start to scar the esophagus. This could narrow the esophagus and make it harder to swallow and more likely to trap food. This could cause serious issues like vomiting and choking. At the same time, the inflammation of the esophagus raises the chance that you could tear the tissue that lines the esophagus. This could happen when you vomit or even when your doctor examines your esophagus with an endoscope. When should you call your doctor about eosinophilic esophagitis? If you notice a serious flare-up of your EOE, it might be time to call your doctor. Symptoms that require medical attention include problem swallowing, unexplained weight loss, unexplained vomiting, stomach pain. Call 911 if you have pain in your chest, food stuck in your throat, a hard time talking or breathing,